Welcome to BDI Briefs. We're here with another exciting episode where we take a brief look at important issues about the emotional side of diabetes. Thanks for joining us today. I'm here with Dr. Bill Polonsky, president of the Behavioral Diabetes Institute, and Dr. Susan Guzman, director of clinical education at the Behavioral Diabetes Institute. Both are world-renowned diabetes psychologists and two of my favorite people around. My name is Scott Johnson. I've lived with diabetes for over 40 years and have been active in the diabetes social media space and industry for a long time. And with introductions out of the way, Bill, what are we looking at today?
Thanks, Scott. We all want to talk about something that's, I think, pretty important, which we call problematic medication taking. In the old days, we used to use words like medication compliance and medication adherence. But my colleague Susan has taught me not to use those terms, although I still fall back on it. It's just an old habit. When we think about it as the issue of medication taking. And to get us started, I want to tell you something about what we know about medications in the treatment of diabetes, whether it's oral medications, whether it's injectable medications. We know there's a lot of choices. In fact, over the past decade or so, there's been an explosion in a number of different kinds of medications that are available for people with diabetes. This has really been good news because these new medications often are really remarkably effective. And yet what's been disappointing about that is that if you really looked at glucose control in large populations, look at A1C levels in people in the United States over the past couple decades, it really hasn't changed very much. So we have this very strange, seemingly odd problem where we have this better medications, way more choices, way more options available, and yet not seeing much of an impact across this country in terms of people achieving better glucose outcomes. And of course, one of the major reasons that's happening is for the obvious reason, which is medications don't work very well if people aren't taking them. And that's why I want to talk about this topic today. So I want to set the stage, and then we'll all chat about what the real issues are, and we'll talk about what some of the real solutions are. And I hope this is valuable for those of you who are healthcare providers, but also those of you who are living every day with diabetes, whether it's type 1 or type 2. So certainly we aren't the first people to think about this issue and to recognize that there's a big problem. I'm not going to spend a lot of time going over all the data showing that large percentage of people with diabetes over the course of, say, the first year after they start a medication simply aren't taking it within 3, 6, 12 months afterwards. And there's been lots of efforts to understand this and to figure out what to do. And what we know from studies that have looked at interventions, they look at, simple interventions like this, what if healthcare providers provide people with written instructions about exactly how to take these, or provide them with what we call stimulus control efforts. And that sounds fancy, but it means hey, why don't you leave your pills next to your toothbrush or the coffee pot? It means involving loved ones, family members and friends, or packaging medications in little pill boxes or blister packs or some other way. And in fact, there's hundreds of other kinds of strategies that have been used. And when we look across studies that look at how effective those are, actually there was a recent review, not recent, actually from 2017, that reviewed more than 700 of these very well done, what are called randomized control interventions. What they found is there was an effect, but it wasn't much of an effect at all. What we call an effect size suggests it was a small effect. And the conclusion from this large review of all these different studies was, not only do we have this modest effect, but the bottom line is, as they said very politely, much room remains for improvement, which mostly just means our interventions to try and help people to be more successful in taking their medications every time don't really work that well. And we think we understand what the reason is. We think we understand what's missing. And what's missing is if you look across the vast majority of our interventions that are typically used every day by many healthcare providers like those of you listening and watching us right now, most of those interventions are focusing on the idea that, there's a behavioral problem, and one behavioral problem in particular, and that's forgetfulness. It's forgetfulness. It's the main reason why people are struggling around their medications. Actually, that's often what people tell us. And so we look for interventions that try to deal with forgetfulness. Well, how about if I just call you every few hours or give you a little app that will remind you or give you a timer? Or put it on a special pill box or you put it next to your coffee pot, things like that. It doesn't work very well. And we think the reason is because the problem for so many people isn't forgetfulness. It's something else. And to try to explain what that is, I want to turn to this amazing commentary that was written in the New England Journal of Medicine. And it came from a cardiologist named Lisa Rosenbaum. And I just want to read you a small part of what she wrote. Remember, she's thinking about not diabetes in particular. She's looking at cardiac conditions, cardiovascular disease complications. And here's what she says. It's our job to help patients live as long as possible, free of CVD complications. And although most patients share that goal, we don't always see the same pathways to get there. I want to believe that if patients knew what I know, they would take their medicine. But what I've learned is that if I felt what they feel, I'd understand why they don't. In other words, people are acting rationally. We have to look at people's attitudes and behaviors and their life perspectives on diabetes and on pills and on medications. It isn't just forgetfulness. It's patients' understandable beliefs that we have to respectfully understand better, listen to, and address. And so some of those attitudes and beliefs that are important are, number one, what we call perceived treatment inefficacy, which is a fancy way of talking about something that I'm sure is pretty obvious to you. That when you're asking someone to take on a new, should be a positive health behavior, like taking a medication every day, or like this woman going on a new diet, if you're not pretty quickly seeing some tangible evidence that what you're doing is accomplishing something, odds are pretty good you're not going to stick with it for very long. And that's a big issue, especially when you're dealing with a relatively invisible disease like diabetes. Take your metformin every day. What's the effect over the next couple months? Well, you don't look at your blood sugars, probably not much. You're not going to notice anything because high blood sugars don't actually hurt. Another important issue is, well, all this, medications, insulin, other injectables, they can be expensive. And if you can't afford your medications, that's a pretty good reason why medication taking can be a problem. We'll talk about that. We also know that many people actually hold some significant suspicions about medications. So maybe this stuff actually isn't so good for me. People worry that maybe if I take those pills or I take those other medications, maybe that's going to actually hurt me. I've heard about really dangerous side effects. And sometimes they might be right, but we have to be able to talk about that with folks. So it's those suspicions about medications are also a very sizable concern for many of the people I see every day. Actually, most of my family members feel this way, often suspicious about medications as well. Oftentimes, when we think about why that might be true, it's because of things that they read and see every day. Perhaps you've seen ads or commercials like this. Have you ever taken any of the following medications? If so, please call us. We can help you to, make some money and because we know how harmful and terrible these things are. Well, there are side effects to almost all of our medications, but really that's the main reason why we should be taking that? Of course not. And isn't it strange that so many people are quite happy to take vitamins and minerals and supplements, which, by the way, there's actually much less evidence in almost all cases that these are either good for you or not harmful. But yet there is this halo around vitamins and minerals because it's this idea that, well, this is a positive, this is a good thing for me. Whereas prescribed medications, I better be careful about. And finally, the last point about this is we know that another big driver of medication taking is a degree to which the person who has prescribed those medications for you is someone who you actually trust or don't trust. And what you see on the screen here is from a study from the University of California at San Francisco, where they simply looked at that. And what they found is those people who reported greater confidence and trust in their physician, those people had greater trust, are in the blue columns, were more likely to be taking their medications regularly than those who had less confidence and trust. And you can see across the screen how that works. People who they felt like their doctor involved them in decisions, understood their problems, put their needs first. All those things are related to doing a better job with one's medications over the course of time. And that should be obvious. It's true for any of us. If You trust your doctor? You trust the person who's recommending these meds, who's telling you that, yeah, there might be side effects, but I'm pretty sure the positives outweigh the negatives. You're more likely to go along with them. So it's basically just this recognition that these things, the ways in which our patients think about their medications, are important. And if they're having trouble problematically with taking their meds, it's not because they forgot or they're bad people or in denial. It's because they're having ways of thinking about their meds that we want to listen to and be respectful of, and perhaps try to address, which we'll get to in a minute. But let me stop. I've talked way too long. Susan, Scott, chime in. What do you think about all this?
I'm going to plead guilty to thinking that forgetfulness was a primary reason for people not taking their medicines. I think this sheds a whole new set of lights on reasons behind why people aren't taking their medicines more. And I can actually see behaviors of close loved ones in some of these descriptions. So it's very enlightening, actually.
Susan, what do you want to chime in? I know you and I have been studying this stuff for a long time.
Yeah, and relating to this study that you have on the lack of physician trust, I thought one of the, when you dig a little deeper into this study, one of the really interesting things was they looked at cardiometabolic medicine. So that included not only diabetes medication, but blood pressure medication and cholesterol medication. And guess which one had the biggest relationship to trust? It wasn't even across the board. And the reason I'm having you challenging to think about that is because there's one particular area in there that we do a lot of negotiating with. And the biggest effects for trust had to do with the diabetes medication, the glucose lowering medication, not the blood pressure medication, not the cholesterol medication. It was the biggest effect. I mean, there was an effect, but the biggest effect was for glucose lowering medication. So that's one that people tend to negotiate with more. Like, do I really need that? I hear if I lose weight, if maybe those medications in particular mean something bad about me. Maybe that means I've failed, and maybe that means my diabetes is getting worse, and maybe that means I'm getting sicker. Where people don't necessarily do that with other chronic health conditions like high cholesterol and high blood pressure.
Well, they do. They just may not do it as
much, right?
Often.
Right.
Before we go on, I just want to mention, respond to something that Scott said, which is, because I want to make sure I say this correctly. Forgetfulness is a big issue for many folks, and certainly in certain subsets of the population, especially if you have diabetes and you've gotten pretty old and you're starting to lose your ability to have if you're not thinking particularly well, you're losing your memory. Yeah, forgetfulness can be a big issue. For people who are living really profound, chaotic lives, they don't have a lot of structure in their lives. Again, forgetfulness can be a big issue. I guess our whole point is we want to emphasize it's not the only one. And if we only address that, we're missing a lot.
And one more thing about forgetfulness is that when it's an easy thing to explain for behavior, and it's a good safe face, like, oh, I forgot, rather than I don't trust you, doctor,
Yeah, that's a really good point. All right, so I know our time is limited, so let's talk about the most important part of this, which is what do you do about this? Especially if you're a caring healthcare provider and you're running into lots of folks who are really struggling around taking their medications. And again, we have overwhelming evidence. If we can help our patients take their medications more reliably and regularly, we can help them to get to a safer place with their diabetes and live a long and healthy life. So I have a very short list of things that we know that really matter, and I want to walk through this with you guys. And there's really just 5. So I want to start with the first one. The most important one is this. You need to ask your patients about this. That's what's really critical. We find so often that healthcare providers will tell us, Susan, you hear this all the time as well. Well, I've heard about this problem with medication taking, but no, not really with my patients. And oftentimes that's because this is how we ask. Hey, Mrs. Smith, nice to see you. Look, you're not having any problems taking those pills I told you to take, are you? Now, we've asked the question in such a way, the answer is definitely going to be, oh, no, doctor, I'm fine with this. So we want to ask this in a different way. by saying, for example, most people we know oftentimes forget or struggle around taking their medications. What's it been like for you? How do you think about your meds? I don't know. Scott, Susan, any other ideas about how you might approach that or what you might else say?
I mean, I love this question, this point, because when I think about, I don't believe there's any such thing as small change, right? And so when you're introducing a new, whatever it is, into someone's life, it takes some time to kind of figure your way around that. And I think it's amazing to be able to check in and ask open-endedly, like, how's it going with that new adjustment we made? What are you experiencing? And open it up and see how that goes.
And to normalize that it's hard for people, I've asked you to do a new behavior. It's hard for a lot of people. How's it going for you? Like, just make it an okay thing to bring up.
And even if you quit that medication I recommended to take, or you haven't started it, I want to normalize that, because in fact, a lot of people feel so uncomfortable and so, suspicious, they may not start. So I want to normalize that, but I want to keep talking about it, because I'm probably still going to try and talk you into it. So the second thing on the list is just forgetfulness, because it is real. So again, there's things that we know that can address forgetfulness, and it's those simple things that we've already mentioned earlier, like asking people to leave their pills next to their coffee pot or their toothbrush in the morning, by helping involving other people. So again, some of those things I mentioned before that don't work very well in large populations can make a difference if we're focusing specifically on that population where it is forgetfulness and not other things behind forgetfulness. Because we know that even people who say, oh yeah, I do forget my meds often, if you ask them more, they're more likely to say, I'm really sure they're accomplishing anything anyway, or they're kind of expensive. So there's other reasons often we want to just ask about and listen to respectfully. I'm just going to go on. Patient-provider trust. We know, as I mentioned earlier, how important trust is. This is a big topic for Susan and I, and probably the most difficult one to address really quickly. I would say when healthcare providers can become better listeners, when your patient knows that we're on the same side, and that's simply you're doing that by being a better listener, everything begins to change, everything. And if you're a busy healthcare provider and you have no time, thinking, oh my God, you got to be kidding me. It doesn't have to be a half an hour of hanging out with your head at an angle and nodding with great empathy. It means taking a few moments at the beginning of an encounter with any patient to say, Mrs. Smith, it's nice to see you. Can you tell me, what's been driving you nuts about diabetes? What's been going on in your life? Anything to treat that person not as a number, but as a human, begins to engage empathy and collaboration and trust. And we know how important this is. What do you guys think? Comments about either of those, Cece, Scott?
Yeah, I think that when I think about patient-provider trust, I also want to point out that we as patients in that equation have a responsibility to be responsible advocates for ourselves and maybe push outside our comfort zone a little bit and be brave enough to bring up things that we are struggling with or can't figure out, and not be afraid to open that discussion up. I think that's important too, and that at least some of that responsibility falls on us as the patients. And
yeah, that's a really good point. Like, if I'm not comfortable with what you just recommended I take, doctor, right, or something like that, it has to be two ways. And that.
I was just going to add, and it's kind of leading into the next point, which is about asking about beliefs. But when you are listening, kind of have a sense of what you're listening for. And what I'm encouraging people to do is listen for the good reasons that they're having a challenge with whatever you're recommending. Like, really listen for the good reasons. And they don't have to be good reasons to you, but that you respect the fact that they're good reasons to them.
Yeah. And I guess I would just add, if you're going to be able to listen to that, you have to ask about it, right?
Right.
Point 4 is just to make sure that you, when you see an issue like this, you just ask, how do you think about that pill or those medications that I've been prescribed? And specifically, I like to get into the details. What do you see? And Susan, I hope echoing what you're saying. I would ask people, how do you think about what the possible benefits are to that metformin or that Ozempic, or whatever it is I recommended you take? And what do you see as the negatives? And how do you think about those positives versus negatives? And having that kind of discussion can tell you so much about what's really going on. Am I getting at what you were saying, Susan?
Absolutely, yeah.
I think too that this also really ties into when I think about it, points number 1 and 4 are somewhat related, aren't they? In that if, let's say, a family member starts a new medication and they think that they're experiencing side effects related to that new medication, being able to talk with the doctor to verify if that is true or not, and find out if there are options or if that's expected, and kind of what does that path look like? It ties together.
We know that about 30% of all the prescribed medications in the market do have what's called a black box warning. They potentially have quite significant and serious side effects, potentially. And yet, all those medications are still prescribed. Well, what's going on? Are these people evil who are prescribing these? Well, no. Is that individual is prescribing it, that physician, whoever it might be, believes, as he's recommending this medication for you to take, that the benefits, the pros, simply outweigh the potential negative. And you as an individual patient may or may not agree with that, but it's important to have that conversation, because if you trust your physician, you might believe he actually knows enough to be making a reasonable recommendation for you. And that's why the last point on this slide, that's why these points 1 through 5 are in this order. It's only after doing 1 through 4, we want to be able to, again, respectfully offer new information. We want to, first of all, address the reasons why taking these medications might be necessary. It's called perceived necessity. And that means talking about the pros. We meet people all the time who say, yeah, my doctor told me to, take this stuff called Januvia or put me on insulin, whatever it might be, but I don't really know why I'm taking it, and I don't know what it's supposed to achieve. And again, there's been lots of studies showing that many people are convinced that taking their medications actually are helping or accomplishing much because they can't feel it. So are we actually helping people to come to believe that medications are potentially valuable and can accomplish something? And at the same time, we want to talk about people's perceived concerns, so that people have told us about their suspicions about these meds. Well, my grandmother, I remember a doctor put her on insulin, then all of a sudden she began having trouble with her eyes and kidneys. And now you want me to take that stuff? I don't know. We want to be able to talk about that. Well, probably it wasn't insulin to your grandmother. It was the fact that there had been no interventions to help her get on any medications for decades. That was an issue. That people have understandable concerns that are worthy of being discussed. And we know that we can address many, if not most of them. And by the way, sometimes you can address these pros and cons together. And I'll tell you my favorite way to do that. One of my favorite examples is sometimes I'll meet someone who says, well, my doctor, I'm new to diabetes and they recommended I take metformin, but I don't know. I've heard bad things about that stuff. And I go, yeah, there's some significant side effects to metformin you should be aware of. Let me give you an example. There's some recent evidence that one of the side effects is it may reduce your risk of developing certain types of cancer. And people go, wait a minute, that's a side effect? Yeah, just thought you should know. There's also some mixed evidence that it actually might reduce your risk for certain forms of dementia over the course of years. Wait, but that would be a good thing, right? I go, yeah. So there's ways of providing new perspectives and talking about, I think, medications that we can help people to be concerned, as they should always be. We can empathize with the fact that most of us would prefer to be taking less or none, but to help them come to, with the right information, with the right evidence and the right knowledge, come to good conclusions on their own that can help them. And again, we think if we can help people on the right meds and stay with them, we know we're helping them to get to a safer place with their diabetes. So I'm going to shut up and let you guys talk now. What do you think about those last points or any of that in terms of how we want to leave this with folks?
I really enjoy all of these points. I think offering new information and education around the medications is really valuable. It can be a little scary if we go off. We as patients go off and do our own research on these medications. There's a lot of misinformation out there. There's a lot of good information out there, and with that information, it should lead to a beneficial and informative discussion with your healthcare provider. I think one of the points I want to make is don't go read some scary side effect story and leave it at that. Bring that back. If you've bumped into that information, bring that back to your provider and have a conversation with them.
Exactly. Yeah.
Very good point, Scott.
Susan, anything? How else would you want to conclude everything we've talked about? What else would you want to add?
I think just from a healthcare professional perspective, I think it's very easy to forget to, as the professional, to forget to follow up on the medication. And unless you're in a system where you can see refill behavior, it may not even occur to you to ask. Like, I know for myself, I don't really get asked about this at all. What I hear is, do you need a refill? Not how is it going?
Right.
And you can learn a lot about how a person feels about their chronic health condition, in particular diabetes or high blood pressure, just by asking the question. And as a mental health professional, when I'm working with someone who's really struggling with, their diabetes, when I ask these questions, a lot of times I ask them just to bring their medicine in so we can talk about what they're on and I can know. A lot of times people will show me this and they'll sit like their medicines and they'll go, I don't even know what this is or why I'm supposed to be taking it. And there's the problem right there. And sometimes these interventions are so easy. Like I'm like, oh, well, that's your blood pressure medication. And here's why it's important with diabetes. And they're like, oh, well, if I knew that, I'd been taking it. And to me, that's really a bummer because that was a very simple intervention.
Well, I do also want to acknowledge there's a layer of overhead work involved in simply managing prescriptions. I don't know about most people out there, but mine rarely run out at the same time, which means that if I go to a traditional pharmacy, I might be making 3 or 4 visits to a pharmacy every month, and that's a hassle. And that's just picking them up. What about keeping track of when I need to request refills and whose doctor does the refills? And there are ways to systemize some of that stuff and help, but I want to acknowledge that layer of frustration as well.
Very good. Thank you, Scott.
So we should probably wrap up. Of course, one of the reasons I think we should wrap up is because I actually need to go to the pharmacy and pick up some medications for myself. But one of the other reasons is that we've gone on too long. And I hope this is going to be helpful for those of you who are listening. Again, we think if we broach this subject with our patients, we think if we can help identify what we see is a very large problem all over this country, that people really struggle around taking their medications, but they do so for good reasons. And that by simply being good listeners and understanding and addressing those good reasons, as opposed to just wagging our fingers at our patients or focusing on just forgetfulness, we think we can really help people do much better and live longer and healthier lives. So, Scott, that's all I really wanted to say. And Susan, I'm really glad you're here. And, we spent so many years focusing on this subject. Normally, we take a whole day when we meet with healthcare providers to review everything we know about strategies for addressing this. So we've tried to do this as briefly as possible, but I'm glad we've had this opportunity. So thanks.
Thank you, Bill.
Yeah. Thank both of you for digging into this sticky topic of taking our medications. It's clear that there's a lot to learn, but that we're making progress, but there's still work yet to be done. So also big thanks to everyone watching. We appreciate you sharing your time with us. As always, I'm excited to share more in our next episode. We'll see you then. Thanks.